minutes.
Thank you, Mr. Blum. Thank you for coming. I appreciate that. I just want to first go back to what or questions that Mr. Shimkus and you had. If I heard correctly, which I think I did because I wrote it down, he quoted a 2010 position that CMS had that would not have allowed this rule to go forward. And then you said, and I quote, reinterpreted the law to allow this rule to go forward. You also said that you understand the legal concerns that we have, not in that exchange, but no, you understand the legal concerns that we have, which I say you understand that the basis is probably questionable, or else you wouldn't understand our concerns if you didn't understand how we could question that. And you said that you've been pulled in by other groups to get involved in negotiations. You had to come up with this rule because other groups want you to be involved. And I hear from people all the time in my district, veterans, other things, that they're in bad situations. And I just have to say to them, I wish I could help you, but the law is the law. And it's my job to change the law and fix the law to help you in that situation, but I can't just go reinterpret the law. And that's what you said. And I think all of my colleagues, whether Republican or Democrat, House or Senate, should be really concerned of what you said today, that there could be a position of CMS, you want to do something different, so you go back and reinterpret the law on a questionable basis. And I just think that I just want to put out that's what was said, and I'll give you a chance to respond to that if you want to do so, or I can go into my questions.
Well, I think a couple things. As I said during my opening statement, the Part D program has many vulnerabilities. And we did a comprehensive review based upon the policy concerns that come to us from members of Congress, stakeholders, partners, based upon our own operational experience. We chose to propose changes, to talk about our principles, to testify here today, to discuss our concerns, to discuss the vulnerabilities that we see.
But did you have to reinterpret the law to go forward?
We want to invite comment. We want to invite conversation that we don't believe the status quo for the Part D program is perfect. There are vulnerabilities. We have to accept that. We have to accept the program is spending $70 billion, the fastest projected
let
program.
me finish. I only have I'm going to get to a question, but if you have if all of that is true, and if we accept all of that, it still doesn't mean you can just do it without the legislative authority.
And that's precisely why we go through notice and comment period. We want to invite perspectives. We want to testify before this committee to explain our rationale, to hear disagreement.
But the legal side, I'm not just saying whether the rule is correct or not.
During the comment process, many stakeholders submit legal opinions. Law firms submit comments to us to tell us whether we're right or we're wrong.
But you had to reinterpret the law to get to where you were. That was your quote.
I would call it a clarification, sir.
Okay. Well, you said reinterpret. One complaint I don't hear from my constituents is Medicare Part D. I just don't hear from them on Medicare Part D as a problem moving forward. And you did say in your opening statement.
I would invite you to look at the complaints.
I'm going to look to your complaints and see, but I don't. When I go to town hall meetings, nobody stands up and says I don't like my drug plan. But so one of the things you said, you support competition as long as seniors understand, and you know that. Imagine going into a superstore and saying, "Here's the aisle limited choices for people that are 65 and older, and here's the rest of the superstore for everybody else." And you know, it just says, you know, they do understand, and it's the minimum report says up to 50% of Part D plan choices may be eliminated or materially changed during 2015 or 2016 based on provisions in the rules. So some of my constituents will have plans that they chose, plans that they like, and if they like what they have, they can keep it, as we've heard. And I know that when constituents under the ACA plans were changed, and people were just saying, well, they were paying for something they shouldn't have paid for because it wasn't worthy insurance. I've heard that even in this committee. And obviously, so it's just assuming people don't understand what they're buying. And I don't think that's the case. I think people are far more sophisticated and smarter than maybe what those kind of comments give them credit for. And so what do I tell my constituents if they can't get plans because they're limited? You say it's only 2%, but that's 2%.
I think a couple of things. One is we want to make sure that we are incorporating to our final policies the views from the beneficiary communities, beneficiary stakeholders. What we hear from the beneficiary community is that the benefit is confusing. We see from the academic literature that beneficiaries would have the opportunity to reduce their out-of-pocket costs dramatically by changing plans. We want beneficiaries each year to take a critical look at their benefit offerings because we know that many beneficiaries will be able to save, reduce their out-of-pocket costs. That's why we have private plan choices. We want competition. We want beneficiaries to evaluate and be able to understand the benefits for different plan options. But we know that most beneficiaries year to year don't change plans, even though they could benefit dramatically by changing plans. Part of the reason that we hear from the beneficiary community, and again, we invite this public conversation, is the benefit is confusing. We see plans cherry-picking the healthiest beneficiaries, raising costs for the rest of the program. But we will respectfully review and carefully review comments sent to us to make sure that we are fostering competition, but in a way that helps beneficiaries choose the best possible plan, but also make sure the taxpayers don't overspend. I would hope the Congress would want us to manage the Part D budget in the most prudent way.
Well, thanks. I do appreciate you coming today. Appreciate it. Yield back.
Chair thanks the gentleman. Now recognize the gentleman from Georgia, Dr. Gingrich.